Thanks for joining us today for a news briefing of the Unified Command of Jefferson County. Today we will have 4 speakers. We're going to start with Dr. Mark Wilson, Jefferson County Health Officer, then James Coker, the Director of Jefferson County EMA. Following will be Jimmy Stevens, Jefferson County Commission President, and then following will be Dr. Sarah Nafziger, Co-Chair of UAB's Emergency Management Committee. We're going to take questions following each person's individual remarks to minimize foot traffic. We'll welcome Dr. Wilson to the podium now for his comments.
Thank you, Savannah. This afternoon, I'm going to just give you some updates on where we are with the numbers on COVID-19, but I also just want to talk to you about the overall situation and how we really need everybody to come together and help out with this situation. So if you look at just this past week, we've averaged over 1,700 new individuals being tested for COVID-19 per day. That's new individuals, not new tests. There are many more tests than that being done. Out of those, we've had an average of 272 new cases per day during this past week. That's a percentage positivity rate of 15%, which is the highest rate in a week that we've had so far. While the care for COVID-19, I think, has really improved drastically since this pandemic first hit and our hospitals are having better outcomes, we're still averaging just over 2 deaths per day in this county from COVID-19. And that really doesn't account for all the suffering that is occurring, the people who are suffering permanent disability after a bout with this, and just the very long recovery times for somebody who's been in the hospital. As far as hospitals go, per this morning's report from our Jefferson County hospitals, this is just Jefferson County, there were 278 COVID-19 positive patients in our hospitals. 110 were in an ICU bed. 52 were on ventilators, and 41 patients were in hospital under investigation for suspected COVID-19. If you take all of this in perspective, if we look back to late March and early April, you'll recall that all of us were really in panic mode. The pandemic was hitting. Our hospitals were starting to fill up quickly. We were rapidly trying to make plans and address the many different issues in our community, the populations that were at risk. It was crisis mode. Since then, many of us have just grown accustomed to the fact that we're in a pandemic. I think that's normal for us to just have to get to a place where we get along with our daily lives. But some have really decided just to go back to living as if there isn't a problem at all. And I just want to really emphasize that right now, we are in a much worse place than we were back in mid-April and late March. COVID-19 is now putting a strain on every part of our healthcare and public health system. Our hospitals are under strain, and you'll hear more about that from Dr. Nafsiger. Our hospital staff are getting fatigued. Our testing sites and the staff that work there are at or near capacity and also working very hard. Our labs are reaching capacity. Our public health workers and contact tracers are under great strain, working 7 days a week and currently not keeping up because of the sheer numbers that went way up 2 or 3 weeks ago. Our first responders, many are being taken out by COVID-19, making it harder for them to respond to emergencies. Some of our businesses are being closed not by public health orders, but by the virus itself infecting their employees. So I think many people are used to me quoting numbers, and after a while I think we get a little immune to the numbers. But I really want to appeal to the public. Because our whole system is under strain and these numbers are at an all-time high, we need your help. We need everybody to do their part to turn this around and get this under control. I want to mention in particular young people. Right now, the preponderance of cases that we're seeing, or new cases that we're seeing, are in that age category of 20 to 45. Now, while younger adults are a little less likely to get severely ill or end up in the hospital or die, some are ending up in the hospital. Some are dying. Even for those that are not sick enough to be hospitalized, this is no picnic for some. It can make you very sick, and this is not just the typical flu. Some don't get very sick at all, but you just don't want to take a chance. And I also just want to emphasize that younger people are spreading the disease. So think about who you interact with, think about your family, think about your home situation, those that you might be spreading this disease to that could be more vulnerable, or somebody that's in that chain of spread that could ultimately be a vulnerable person, maybe one of your own family members. We have some public health orders still that put rules on businesses and public venues to help keep us safe and help keep those businesses open. We are now under a statewide face covering order, and we're getting fairly good compliance, but we need 100% compliance with that to really be successful. And I finally want people to think just about not only those businesses, those public places that are under rules right now and where face coverings are required, but really think about those private gatherings, even in your own home. Who's interacting with whom? Where have you been? Where have other people been where they might have been exposed to this and not know it yet? That's where we're seeing a lot of spread. That's where government doesn't have a lot of control over behavior. So we really need you to think about that, protect those around you, and make sure you are being safe in those settings. Thank you.
Thank you, Dr. Wilson. We're going to open it up for questions for Dr. Wilson. So if somebody would like to begin or raise your hand, we can get started. Does anyone have a question for Dr. Wilson?
Hey, Dr. Wilson, Chip Scarborough from Channel 13. Just wanted to get your thoughts on businesses in the area, and are they doing enough to enforce the guidelines that are in place right now?
Thank you, Chip. Yeah, I think a lot of businesses are really doing a good job. I think many of them have realized the importance of not only protecting the public that comes into their business, but their own employees, which I think is extremely important. There are some areas that we're still concerned about. We've been told, not just myself, but other public health professionals and Dr. Fauci, that bars and restaurants with indoor service are a place of higher risk. We're concerned also about our nightclubs. So our environmental health staff that regulates these places anyway for food safety are heightening up their efforts just to check on them to make sure they're complying. I will say some are doing a great job, but we also want to make sure if they're not doing what they should do, that we're talking to them, helping them get into compliance to make sure they do it right and keep everybody safe.
Thanks, Chip. Brian, with ABC 3340, you can ask your question.
Okay. Can you hear me? Okay.
Yeah, we're good.
Okay, great. Dr. Wilson, thank you. Question for you. In terms of these numbers keeping going up and a little bit, but I just want to get, what exactly is the main cause of these numbers going up? Because we've been telling people about social distancing and wearing face masks and all that other kind of stuff, but what's actually causing these numbers to increase? Is it the pull in going to bars, having private parties, or what exactly is the main problem here?
Yeah, that's an important question. I did check with our disease investigators just today to see what sort of trends they're seeing. And really, there's not any one particular place or event or venue that we can point to or type of venue that's driving a lot of our cases. You know, early on, it was a lot of our numbers were nursing homes. Unfortunately, that's gotten better. A lot of work has been done there. Hopefully, we can keep those down. But now it's really just widespread, random pop-ups here and there, individuals. And I think that's, you know, other than that, we can't say it's one particular type of activity. I do think, again, that a lot of it probably is occurring in private gatherings within homes, things that are happening more often in the summer, like wedding showers and weddings and things like that. Just places where people are gathering for parties. So that's our hunch, and that's again why I'm really hoping that everybody in the public will take this seriously, understand that they have to take precautions no matter where they are and no matter what they're doing.
Thanks, Brian. Morgan, I'm going to unmute you. Morgan with Fox 6, you can ask your question.
Thank you. Dr. Wilson, one of the things you just were talking about, the hospitals being strained, the testing sites being at capacity, lab sites, and then first responders being impacted by this virus. I personally haven't heard a lot about first responders being affected, but what is the impact of all of the things that you described, and when are we going to start seeing that in our community?
Well, I think you're going to hear more about the hospitals here soon from Dr. Nafsiger. You know, we're always concerned about our hospitals. We're concerned about the staff that works there that have already been working very, very hard, and we have a long way to go here. Also, the impact that it can have on people's ability to get other care besides just COVID-19. In terms of our test sites, you know, everybody's just been working really, really hard. But some of those staff are getting fatigued. And we're starting to see longer wait times for people to get tested when they need to get tested. That wasn't true a couple months ago where we had plenty of capacity and we were encouraging more people to get tested. So now there's a wait in some cases. And then the labs themselves, a lot of labs that were giving us 24-hour turnaround time are now starting to go to 48 hours, some even as long as 5 to 7 days and longer. And when you get a test turnaround time, or the time to get tested and then a test result turnaround time that's that long, you know, pushing a week or 10 days, it becomes less and less useful for us in terms of our contact tracing and quarantining work that's meant to get this all under control. When our testing positivity rate is up at 15%, that also means that we are missing a lot of cases. We really need to be doing enough testing and have a low enough incidence in the community that that's less than 5% to give us a chance to really get this under control. First responders, as you can, you know, it's sort of spread around. Different entities have had issues with first responders becoming positive, both police and our fire and rescue people. And if you think about some of those situations where police might be working together in a station, or firefighters are together in one fire station spending a whole shift together, that, you know, one becoming positive potentially puts several out because they've been exposed. And so the impact of that, you know, so far I think folks are managing, but you can imagine the impact of that if we have a lot of our first responders put out of commission.
Thanks, Morgan. Ask a question from the chat. Christy with WHNT in Huntsville asked, you mentioned young people spreading the virus. A recent Reuters survey shows more people are becoming infected in the home due to this issue. Essentially, young people bringing the virus back into their households. What does that indicate for the upcoming school year?
Yeah, the school situation is a very challenging question, and our health department and other doctors in the community coming alongside of us are having some conversations with our school leaders. We had a call with them last week, and we're going to follow up again this week to help give them the best advice we can and the best guidance we can to help them make really good decisions. But I would say also, just again, an appeal to to our young adults, and I would say teenagers too, there is evidence, while there's evidence that our very young children, say less than the age of 10, might not spread the disease as effectively as adults do. That's good news. They also don't get as sick, and that's great news. None of us are willing to say that the youngest children are zero risk for spreading disease. I don't think that's true, but fortunately it's a lower risk. But for the teenagers, there's some evidence that they may spread disease as efficiently as full-grown adults. So that's a little bit more of a concern. So my appeal to families and to the teenagers and to the young adults is to really think about your family, those that you love, and take some responsibility for being careful. It's not just about you. It's about people that you love. And, in some cases, you're going to have to think about even taking precautions within your own home. And that's just a fact. We all need to be more careful.
Thanks. Malik, I'm going to unmute you if you'd like to ask your question.
Dr. Wilson, Malik with CBS 42. I was just wondering, you mentioned bars being a concerning area for the spread of COVID-19. Do you think close contact businesses like bars, salons, barber shops should close now that we have the mask mandate in effect, and also even potentially reconsidering the curfew we had at one point?
I think that a lot of the hair salons and places are doing a really great job, and that's been very encouraging with the workers and the clients both being required to wear face coverings and additional social distancing things. It seems like that's going pretty well. The bars are something, again, we're looking at very closely. Our approach as a local health department, again, is to heighten up our efforts to check on those and to help them get into compliance if they're not. We do have a mechanism for emergency closure if we have to do that. It's the same thing we use if in our food inspections we find a very unsafe practice that's an imminent public health concern. So we have the ability to close individual venues if we need to. We don't want to do that, and in the cases where we do, we would have a plan to help them reopen as soon as possible as long as they can safely do it. In terms of orders of closing places in block or all across the board, we would prefer not to have to do that. My preference, if it ever comes to that, would be for that to be coordinated with the state health officer and the governor's office to make that at least a regional effort, if not statewide. Because one of the problems we have with going it alone in Jefferson County is that we are part of a greater metropolitan area of 1.2 million people, several counties where there's a lot of traffic going back and forth. So that just makes that consideration that much more complicated.
Thanks, Malik. I'm going to take a question from Facebook, and then we'll go back to Morgan with Fox 6. The question from Facebook, basically, kind of to what you were just saying, Dr. Wilson, if we, as a patron, go to a restaurant or a business where people aren't abiding by the mask ordinance, is there something that a person can do? Who can they call to make sure that that business begins following the order?
Yes, there is, and we want the businesses to succeed. And so we want to be fair to businesses, but if you do see something that's really concerning where the business is not doing the right thing, they're not following the statewide orders, you can call our health department's environmental health division. The number is 205-930-1260 and file a complaint or describe what you've seen. Now, I will say some businesses can't completely control the behavior of everyone, but if you do see something that's concerning, doesn't look right, you should call us. We will check into it. I will say to the businesses, we are very fair, and we're not going to do anything based just on hearsay or somebody calling. We always have to have our own employees see something in order to take action. But we would appreciate the public's help if you do see something that's not right, letting us know so we can address it.
Thank you. Morgan from Fox 6, you can unmute and ask your question.
Dr. Wilson, do you think at this point with the testing delay jumping, from 5 to 7 days to get a result, just from the 24 to 48 hours that you were describing, is that at a point now where that might be contributing to community spread? Because if you only have to wait 24 hours to get test results, that's more feasible for a person to stay home. But something like 5 to 7 days is not really likely for people who are working and have other things going on.
Yeah, we will be sending out some updated guidance on this for the public, as well as some information that we're going to push out to people as they're tested to give them specific instructions. So just a couple of points about that are very important. First of all, if you have a known exposure, that within 6 feet for 15 minutes rule, to somebody who's known to be positive, then you should go ahead and isolate or self-quarantine whether you're tested or not. That's number one. Number two, if you have symptoms, you're sick with symptoms of COVID-19, and those symptoms are listed multiple places. The CDC website is a good place to look if you're not sure. Then you should also self-quarantine and until you get tested, and if you get tested, you should continue to quarantine until you get that result. So that does, to your point, it does drag it out some, but what we don't want people doing is circulating in the community when they have a known exposure or they have symptoms and just don't know yet. They need to treat this as if this is COVID-19, because that is one of the main drivers right now of symptoms, especially here in the summertime.
Thanks, Morgan. All right, we're going to move on. We've got 3 other speakers, so thank you, Dr. Wilson, for joining us. While he gets his mask on and we make our change, the next speaker will be James Coker, who's the director of Jefferson County EMA. Give us 1 minute while we get resituated.
Okay. Good afternoon, everyone. I'm Jim Coker from Jefferson County EMA. Thought I'd give you an update on our activities since the middle of March. In the middle of March, the County Commission declared an emergency. We are still in the same emergency. This is the longest declared disaster that we have ever experienced here. And we had to find a new way, along with public safety, to work. Typically, during a disaster, we all gather together, we solve problems, we have many different agencies involved. We couldn't do it like that this time. So we had to learn how to do this virtually. This was something new for us. We've adapted, and we have learned many, many lessons that will stand us in good stead for years to come. We are now in our 18th week of working virtually. One of the very first things that we did was establish a joint information center. You may have heard the term JIC in some of the newscasts and so on. Simply put, a JIC means many agencies speaking with the same common voice. We want to make sure that the information that goes out comes out from a virtual podium. It's correct. It's the same information from all the partner agencies involved. We don't want to have any kind of misunderstandings, so that was why the JIC was one of the very first things that we established. A few other challenges that we've had was learning how to fulfill the many resource requests that we've had from public safety, from hospitals, from nursing homes. Just imagine how many people need personal protective equipment, need cleaning supplies, and so on. So we have developed a system to do exactly that. About 2/3 of the requests have been filled locally, and we have asked for assistance from the state for the other 1/3. Since the end of April, we have fulfilled over 450 requests. This can be something very small, or this can be something that's in the tens of thousands of masks. So we've worked very closely with Jefferson County to do this. We use county personnel in their warehouse to house our PPE. I would like to mention that we have many, many people, and I emphasize people, working on this problem for many agencies. It takes a lot more than just one group to tackle this issue. I want to thank all the many different agencies for providing your staff to assist our staff. It takes a team, and this has very much been a team effort. Other things that we have worked on have included working on testing procedures for public safety. As Dr. Wilson mentioned, Keeping public safety healthy has been a challenge, and it'll be a challenge because they are people too. And they could be exposed on a call. They could be exposed when they're off duty. But if you call, they will still respond. They will always respond. So we've put a lot of time and effort into working with our public safety to make sure that they are prepared and they can be tested and continue to be at work. Lastly, and this is back to the public, you're part of our team. You are absolutely part of our team. Our staff recently all got tested. We're happy to report that we came back with negative results. Part of that is because we strenuously adhere to masks, hand washing, social distancing. We're trying to protect ourselves so we can continue the work for all of you. And that applies to everybody in the public safety realm. We need your partnership. We need you to be a part of our team. So please go to our website, jeffcoema.org, for more information. It's updated daily. It'll take you to many other links for good information. And thank you for your time.
Thank you. Does anybody have a question for Jim? Malik with CBS 42, you can ask your question.
Just wanting to know, what obstacles are you all currently facing now, and what can the public do to help you all in that?
What obstacles is a very, very broad topic, but I'll try to narrow that down a little bit. Many of the plans that we had made, we cannot do right now. Typically, we'll provide a lot of training for public safety and other agencies. We can't do that right now because a lot of this is in-person training. So we've had to postpone that or move it online. Another, and I won't call this an obstacle, I call this an opportunity. We've been able to work with a lot of other groups and agencies that we just haven't worked with before, such as many of those who work with public feeding. And we've learned a lot. That is not an obstacle. Again, that's an opportunity. We didn't fully understand the many, many hurdles that they have to face, but we understand now. And that understanding has helped us to alleviate some of the issues that they were facing.
Thanks, Malik. Does anybody else have a question for Jim Coker with Jefferson County EMA? Okay, then we're going to welcome Jimmy Stevens, Jefferson County Commission President. Give us a second while we transition.
Good afternoon, everyone. First, I want to thank and acknowledge our unified command and our community partners for their continued heartfelt engagement to stop the spread of this virus. Your many hours have not gone unnoticed, and I can see the difference in your demeanor today than it was 2 to 3 months ago. Our prayers and our thoughts remain with you, my friends. Thank you very much for that. Your Jefferson County Commission has been invested in attempting to mitigate this pandemic from the beginning. Early on, the commissioners allocated emergency funds for the purchase of additional hospital beds and other items needed during a surge in cases. These are, thankfully, still on standby, but are available should the hospitalizations continue to rise. Jefferson County was granted $115 million in CARES Act money. We have allocated $25.7 million of those for distribution to the cities based on their specific populations. We're working with them to fulfill specific requests and are working with the health department and UAB to make sure these needs are met. Application for CARES reimbursements are available through each commission office and through our county manager. All are subject to independent review to determine their eligibility. Together, we are identifying the needs of the people and allocating the CARES funds to meet these individual needs. Testing remains a huge challenge, and I want to thank our testing partners, which again is the Jefferson County Department of Health, UAB, and the Cooper Green Health Services, as we work together to meet this challenge. Partners, this will be a marathon and not a sprint. So roll up your sleeves and get ready. This testing is really just begun. I also want to thank Governor Ivey for her allocation to meeting the needs of our school systems. This is very challenging, and we must work together to make sure that this comes to fruition as soon as possible. Working together, using good judgment and common sense, we can indeed beat this virus. We must work together. Our county commission who operates on C attitudes. You communicate, you cooperate, and you coordinate. I want to add to that, let's use common sense. Let's put our mask on and use our hand sanitizer and practice social distancing. With this, we can beat this pandemic and we can return to our normal life. But we can't do it alone. We are here for you. But you have to do your part with your mask, your hand sanitizer, and your social distancing. Just common sense is all it requires. We need to have that to return to a normal life. And that will conclude these remarks, and I'll be happy to take any questions.
Does anybody have any questions for Jimmy Stevens? Any questions? Okay, thank you.
I must have done a good job. Thank you.
We're going to transition. We're going to welcome Dr. Sarah Nafziger. She's an emergency medicine physician, and she's also co-chair of UAB's Emergency Management Committee.
Well, thank you very much. Happy to be here today. I want to start my comments by saying UAB Medicine is open to take care of you today. Our emergency departments at UAB Main, at our Highlands campus, and our Gardendale freestanding ED are open to take care of you for both COVID-related illness and non-COVID-related illness. I wanted just to get that out there because we've heard that there are some patients who are foregoing emergency care when they need it. And we want to strongly urge our patients, if you're having a medical emergency, something like a heart attack, a stroke, or other conditions that are an emergency, we want you to go to the emergency department and seek care. We are very much open, and we're here to care for you. I think that applies to all the hospitals in town. Speaking of hospitals, every hospital in the county is dealing with the same issues that we're dealing with at UAB. We're having increasing numbers of patients with COVID-19. This morning's numbers showed, I believe, around 270 patients in the county, and we have a little over 100 of those at UAB Hospital right now who are COVID-19 positive. So all the hospitals are really having to deal with and manage an influx of patients with COVID-19 right now. That's why it is so imperative for the community to take all the appropriate actions to avoid continued spread of the virus, such as social distancing and wearing a mask. The good news is that all the county hospitals, we have really been working together under some difficult and trying circumstances. The collaboration has been outstanding. It has been an honor and a privilege to work with our colleagues across the county and in the community. We've been in constant communication with one another to assess needs, to share resources when needed, and to plan for contingencies. So I do appreciate that. You may have heard that at UAB Medicine that we have activated part of our surge plan, and that is true. We have done this to create some additional space to care for patients with COVID-19 in our emergency department area. We've done this by shifting our emergency department waiting room and converting this into a patient care space for patients who have COVID-19 but do not require intensive care services. This is something that we've done now that we have an increasing burden of COVID-19 patients who are in our hospital needing care. And we want to make sure that we can shift our resources around so that we can keep ourselves ready to care for all other emergencies. So that is just one of the changes that we have made to make sure that we're available to care for all things that could come in at any time. At the beginning of this pandemic, UAB Medicine designated intensive care units and acute care units to care for COVID-19 positive patients. The numbers of beds that we've allocated to each unit, it was based on projections of how many beds we thought we would need. As the number of patients requiring hospitalization for COVID-19 has increased over the course of this pandemic and over the past 2 months, we have designated additional beds to care for COVID-19 patients. This primarily involves us reallocating staffing and medical equipment to meet these needs of these patients. The downside of designating additional COVID-19 beds is that, by definition, it reduces the number of beds that are available for patients who have non-COVID medical needs. So, to summarize, what we want is to make sure that we can continue to provide the same level of care that we normally provide every day. So that is why we're taking action and asking you to help us slow the spread of this virus. I'd like to conclude my remarks by saying thank you to Dr. Wilson and our public health partners, Commissioner Stevens, Director Coker, and all of our other community partners. It's been a pleasure working with you, but most of all right now, what I want to do is address you, our community members. If you can hear me speaking, I'd like to tell you thank you in advance, because I'm confident that you're going to help us slow this pandemic by doing the things that we're asking you to do, which is social distancing, stay 6 feet apart, wear your mask, and wash your hands. It's simple. I know that we can do it. Together, we can do this. Thank you.
Thank you. We're going to open up questions for Dr. Nafziger. We're going to start with Malik with CBS 42. You can unmute and ask your question.
Hey, good afternoon. We've been hearing, of course, doctor and nurse shortages and how exhausted staff are. For you all at UAB, what's the bigger obstacle, the bed shortage or a staffing shortage?
Well, thank you for that question. That's a difficult one to answer, and it's really both for us. We do tend to stay quite full. Staffing shortage has been a challenge for us. We continue to have not only a shortage of staff that are available sometimes, but we also have staff who are affected by COVID-19. We have those who are ill. Now that we've had increasing community transmission, we've seen more and more employees who are sick with COVID-19. And then we've also had employees who've had to stay home maybe to care for sick family members who've been affected. So certainly staffing has been impacted, and it is a component of the challenge that we faced. At UAB, we do tend to keep the hospital very full, so bed shortages can also be a challenge. So really for us, it's not one or the other, it's both. It's something that we continually manage to make sure that we can be available to meet the demands that our patients have for care each and every day.
Thanks, Malik. Does anybody else have a question for Dr. Nafziger? All right, Malik, if you have another question, you are welcome to ask.
Thank you. So yesterday, Calhoun County held a similar press conference for hospital leaders, community leaders, and their hospital chief of staff was calling on any nurses that were in retirement, that had been furloughed, that were rotating in other cities, if they were available to come to work. Are you guys doing anything similar?
Definitely, that's a great question. Definitely, UAB is hiring nurses right now. So any of you in the community who may have those qualifications, we would invite you to visit our website and apply if you are interested in a position at UAB Medicine. We would welcome your application.
All right, Morgan with Fox 6. If you want to unmute, you can ask your question.
Thank you. Dr. Nafsiger, I know late last week you were talking about implementing part of the surge plan with 105 patients, the highest y'all have had so far, and then the 3 days of 102. How close are y'all to implementing the next phase of the surge plan, and what would that look like?
So the phases of our surge plan right now essentially involve shifting staffing around and shifting providers around to care for patients. So essentially what we've done is just shifted staffing around in our different units to care for patients. So on the outside, it doesn't really look a lot different, but on the inside, it just involves coordination of care between nursing units and providers. So if you're looking from the outside and think, oh, I'm going to see something really drastic from this surge plan, frankly, it's not going to look very different. The biggest visible change you might see is in our emergency department waiting room, where we've converted that care space for COVID patients. So outside of that, you won't see very much.
Thanks, Morgan. Does anybody else have a question for Dr. Nafsiger before we get to Facebook? Morgan, you can ask a question.
Thanks. Sorry, just for a little bit more clarification. So I know that you have done what you just described, but what would be the next step in your surge plan? I know previously you talked about you were monitoring on a regular basis throughout the day the cases, and then always on the table was possibly having to go back to not doing the elective surgeries or cutting some services. Is that still something that is close to, or is that still far down the road? Just for some perspective about how serious 105 patients is.
Sure. So definitely if the numbers of COVID-19 patients continue to increase in the hospital, then definitely curtailing services is something that we're going to have to seriously consider and likely implement. Right now, we're okay. We're holding steady. But if things get much worse, yes, then that will be the next step for us to have to implement. We don't want to go there. We want to be available to care for people when they come to our hospital with their emergencies. We want to be able to provide care for patients with cancer, for patients with heart disease, for patients who have car accidents. I mean, that's our priority, is to be there. But we're also going to be there for patients who have COVID-19. So maintaining that balance is our highest operational priority right now. We want to make sure we're available for all of those things. So if we can do our part in the community to curb the spread of COVID-19, then that'll help us be able to maintain services for all those other type of medical conditions that we spoke of. So yes, if the surge continues, if the number of COVID-19 patients continues to increase, then yes, curtailing other services is something that we would have to implement.
Morgan, a question from Christy with WHNT in Huntsville. What is UAB seeing with its smaller partner hospitals that may have fewer beds? Are we absorbing more patients, and what does that look like in terms of transfers?
So I'm not the official spokesperson for any of our affiliate facilities, but I can tell you what I do know is that many of our affiliate facilities also are seeing an increase in COVID-19 patient census. So they are definitely pulling their weight and taking care of those patients in their community and trying their best to contribute and doing a great job of that. We do have some patients with COVID-19 who are transferred to UAB. Most of those patients who are transferred are coming in because they have need for critical care resources that are unavailable in the facility where they originated. So some of those specialized critical care resources that we have available with our pulmonary critical care team.
Thanks, Christy. Another question from Facebook. We've kind of addressed this, but can you just give a little bit of an overview again for those who are curious about testing? When should you reach out to your physician about symptoms? When would it warrant a test? Can we just kind of give a 30,000-foot overview of testing right now?
Absolutely. So anyone who has symptoms of COVID-19, you need to consider reaching out to get a test. And the first thing I tell everyone if they ask me is I say, hey, if they call me on the phone and say, I've got COVID-19 symptoms, I say, hey, where are you right now? Because you better not be out in public. You need to self-isolate. You need to get yourself home away from other people, and then you need to see if you can get a test done. So that might be reaching out to your primary care provider. It might be calling a testing clinic. It might be calling the UAB COVID-19 testing center. If you're a UAB employee, you can test through UAB Employee Health. So there are a lot of ways that you can get a test performed. But the first thing that people need to know is if you have a symptom of COVID-19, you need to immediately self-isolate and then seek testing.
Thank you. Malik with CBS 42, I'm going to lower your hand. You can ask your question.
Last question from me, but we hear from you all regularly, which we're so appreciative of. But one of the things we don't typically get to ask you all is how are you doing through all of this with being on the front lines of this pandemic personally?
Oh, thanks for asking. No one else has. This has been, it's been a long few months. It's been exhausting in some ways, but very gratifying for me personally. This is something that I've planned for and trained for my entire career. So this challenge is something that I personally feel that I was prepared for. I wish this had never happened, but it has. And so I'm glad to have the opportunity to serve in the roles that I serve, to care for patients and to help us navigate through this pandemic. I can speak for my colleagues. I can tell you that managing this crisis, it's not been easy. This has been a challenge for all of us in healthcare. I think it's challenged our fundamental beliefs. It's challenged our fundamental dedication to our careers in healthcare. And I can say that for the vast majority, it has solidified our commitment to caring for patients. It's helped remind us why we chose our careers in the first place. And I think it's brought us together in a way that's very powerful and meaningful. So thank you for asking. I appreciate that.
Well, I think that is a good question to end on. Thank you, Dr. Nafziger, and I'll come up to conclude. Thank you all again for joining us today. We will send a copy of this video recording to all outlets here in the next 30 minutes to hour. Just a reminder for those watching, please continue to wash your hands, wear face coverings, avoid large gatherings, and practice social distancing. As everyone here mentioned today, we can do this if we all work together. Again, thank you for joining us.